And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. Good to see you again.
Thank you. Good to see you as well.
Thanks. So as far as red meat in the diet, of course, we all like our steaks every now and then, but I guess too much of a good thing is not good?
And I think periodically it's okay. Maybe once a month is fine, but you have to understand a lot of people are eating burgers and fries every day, hot dogs, bacon, ham. All those types of meats are linked to increased risk of heart disease. So I know they talked about red meat here, but any type of cured meat away from chicken, fish, turkey, typically it's a high-risk type of meat, and we want you to restrict consumption of that. But, you know, on special occasions, certainly it's fine.
Okay, on to some of our viewers' medical questions. This person, I'm a 54-year-old woman, and I'm taking gabapentin. They told me that I have fibromyalgia while I'm taking 600 milligrams of gabapentin, and my left arm and my legs and my whole back is on fire. I can't sleep at night. What else could I do about it?
Well, it's good that, and she feels like she's having a heart attack. Certainly, if you feel like you have a heart attack, call 911 or get to the emergency department.
Yeah. That's
some serious stuff, but certainly we can add medications like Elavil. There's another medication called Lyrica. We can increase the dose of the gabapentin, certainly physical therapy, injections, so a lot of different things she can try.
Okay. This person, I'm 100% positive I broke my nose. Swelling and bruising aside, things seem okay. There is a rather large bump on the bridge and some slight crookedness. Is it necessary to get it checked out?
I think anytime you fracture your body, especially the face, I think it's always important to get a brief checkout. Certainly go to the emergency department, get an x-ray, make sure no significant stenosis or narrowing in the nose needs to be fixed. So I recommend, obviously, to get that checked out.
And what type of doctor? Just a general practitioner?
You can go to an ER doctor. They have the equipment. They're pretty good and savvy at looking at fractures and determining if it needs to see an ear, nose, and throat doctor, which is a surgeon for the face. So probably we'll start out with that.
Okay. Another question. How do I get rid of boils?
Boils are staph infections, typically bacteria, not necessarily the spider running around biting all Americans. It's just staph infection, MRSA or MRSA as we call that. A lot of times we have to use antibiotics. You can use some over-the-counter cleansers such as chlorhexidine, which you can buy over-the-counter, maybe do it every other day. However, if you have diabetes, you work in a bad environment, dusty, oily, greasy, you might have a lot of issues with that. Sometimes we use prophylactic antibiotics once a day for several months.
Should you cover those before you go to work if you work in one of those environments?
I don't think it's going to make a difference. Sometimes those environments will have some policies about certain infections, so you might want to check with your job.
Okay, and what's the best thing to do for cramps?
Cramps, really just to try and find out what's causing it. It's hot, it's humid, right now it's muggy, so dehydration is the main issue. Diuretics for blood pressure is a main issue as well. We can sometimes use things over the counter to help with that. Bananas, I'm not a big fan of that. So certainly just trying to get to the bottom of the cramps.
All right, we've got lots of other questions, so don't go away. Don't go away, Dr. Levine. We'll answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. A woman had a hysterectomy almost a year ago. She's got pain in the lower left side. One doctor says it's diverticulitis. Another says it's a cut muscle from the hysterectomy. What do you think?
Without fever and progressive pain, I would probably agree with the surgeon. Maybe just a surgical issue, post-surgical issue, not necessarily a complication.
Even a year later?
A year later, absolutely scar tissue, and everyone heals differently. And, you know, depending on your activity level right after the surgery, may have aggravated it, so it kind of causes a chronic pain issue. Diverticulitis is thrown around very loosely in this community. We see a lot of people getting antibiotics for abdominal pain, but you have to have the fever. It's got to be a sharp pain. It's got to be in the left lower quadrant. It's got to be progressive. So I probably would go with the surgeon on that issue.
Okay, another question. What causes mouth ulcers?
A lot of times viruses cause mouth ulcers. A lot of times it's self-limited. We don't have to treat it. If it's painful, we can give you maybe some topical pain medicines, a liquid such as lidocaine, but typically it goes away on its own.
What's your opinion on veggie burgers?
Veggie burgers, I think, are a good alternative to the red meat burgers. You have to be careful about anything that's processed, whether it be a veggie burger or a red meat burger, but I think they're a good alternative. Certainly try to get it as fresh as possible. If you can make it, put it together yourself, but certainly anytime it's processed, just have to be careful about the packaging.
Okay. For type 2 diabetic, what's better to drink, regular or diet soda?
I think both of them are coming under a lot of heat, even the diet sodas. because a lot of people think, well, it's diet, I can have a six-pack every day. No. The research is actually suggesting that it can contribute to weight gain just as well as the soda, so probably avoid those as much as possible. Again, it's not something we want to do every single day. Drink more water, maybe coffee, tea without sugar and cream, but you can reward yourself.
Okay. What causes yellow fingernails?
A lot of times fungus causes that. It's very common, especially in the toes. We like to use Lamisil and oral antifungal medication to help with that.
And that's just over the counter?
No, it's prescription typically.
Okay, another question. Sometimes I have sharp pains in my right side. Any ideas on what it could be?
Right side of the abdomen can be tricky. You have the colon, you have the gallbladder, liver, a lot of different things. A lot of times we have to do x-rays, ultrasound, or a CAT scan to figure that out.
Okay. As of recently, my husband has been having itchy hands. They swell. He says it feels like they're on fire. Any idea what could cause this?
Could be a contact dermatitis. You know, our hands come in contact with so many different things. Sometimes the skin becomes irritated with something that we're touching, the itchy burning. A lot of times avoidance, if you can figure out what it is. Topical steroids work very well. Sometimes we have to use oral prednisone to help with that.
Okay, I'm pregnant and taking prenatal vitamins, but I constantly get weak. And I'm wondering, are they safe vitamins to take for myself while being pregnant, and which ones are the best?
The prenatal vitamins are typically very good. Weakness can be from so many different things in pregnancy, so I would be cautious about doing anything over the counter. Talk with your obstetrician for further details.
Okay. I'm a 290-pound, 52-year-old diabetic. My sugar stays around 210, but when I get my sugar right, I start gaining weight. How can I manage without gaining all the weight? A
lot of times people are on insulin, and unfortunately insulin does cause weight gain. The bottom line is you need to exercise. That is the diabetic killer. Regular exercise. We want to encourage most patients to do that. And as you exercise, you lose weight, less insulin, it goes in the right direction.
All right, Dr. Levine, as always, we appreciate you stopping
Yes,
by. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305 or email us at laf@kfdm.com, or better yet, just post those questions every Monday on our KFDM News Facebook page.